Hello, everyone. Today we are here with Dr. Meena Julapalli, and welcome back. This is our second time doing this podcast together.
Thank you.
I remember the last time, it was last year, we had this podcast and we actually met with the signatures event with like the books and stuff. So I actually first wanted to ask you, do you have any, books in the works or upcoming?
Yeah, there's actually 3 more books in the works with other kids. So my first 2 books were, I write children's books, and my first 2 books were with 2 kids who embody the messages of the book. And the next 3 that are in the works are also with different kids who also, in their own way, embody the messages of these books. And it's just been a really fun way to help showcase these kids' passions, and when they share their unique gift with the world, it inspires other people to do the same.
I'm looking forward to reading it. Yeah. So, something that I think makes you really stand out is your use of integrated methods in medicine, right? A lot of integrated medicine. And you're also speaking at a conference for integrated pediatric dermatology, I think next month, right?
Yeah. So I for the last year and a half, I've been training in integrative clinical hypnotherapy, and it has been nothing short of life-changing because it has allowed me to integrate all the different things that I've learned throughout my medical training: Reiki, mindfulness, meditation, art therapy, sound therapy, a little bit of traditional Chinese medicine, Ayurveda, you name it, I've dabbled in it all. Yeah. But hypnotherapy has allowed me to take all of those things that I've learned, and none of it is wasted. I get to use all of it to help guide people towards their own healing, towards healing themselves. And so next month I get to speak at the Integrative Dermatology Symposium about hypnotherapy and dermatology, and I'm super excited about that.
That's amazing, yeah. So what does integrated medicine mean to you?
So, I trained as doctors on this side of the world. We are trained to fix and cure disease, which is a lofty goal, but I frankly pretty limited in all the ways that we can heal one another. And over time, as a healer, what I've come to understand is that was never mine to do. What is mine to do is to help guide people to walk alongside people, to be a witness in their journey and self-discovery to healing themselves. Yeah. So a lot of integrative medicine, particularly, medicine that thousands of years of rich healing modalities with traditional Chinese medicine, Ayurveda, indigenous medicine, all of these are really focused on restoration, on healing, on balance versus fixing and fighting and battling and all of that. And so I think when we focus on that, it's very restrictive. We tend to focus on things outside of ourselves to help. And when you focus on healing from within, it empowers you in a way that you kind of take that power back, and you are not really dependent on anything outside of yourself. And so integrative medicine kind of brings both of those worlds together.
And as you mentioned before, you use tools like clinical hypnotherapy and also heart math in your practice. So for a kid who has severe eczema, a lotion or steroid lotion isn't enough. So what does actually look like in a room when you use breath work or visualization to help and calm them down?
So I think a lot of times when we are faced with a big challenge, whether it's physical, mental, emotional, I think it's really easy to get into that sort of mindset that, why is this happening to me? Why is this not working? Why am I not getting better? Instead of, what can I do to be in the best state of being to already feel healed now? Yeah. And so a lot of times I will introduce breath work or emotional freedom technique, which is like tapping using acupressure techniques, or different kind of mindfulness stress reduction, meditation, affirmations, visualizations, to put people in a mindset where they can already feel the future of that healing in this present moment. And a lot of times, again, when they feel in that state of being, you kind of don't feel defined or limited by the current challenges that you're facing. You're already focused on, you don't feel separate from that ability to heal. Yeah. And so when you get to that point, the treatment that you're on work better. You're not as dependent on the treatments. And again, they now feel empowered with the tools to heal themselves, and they now can advocate for themselves. And because we're compassionate human beings, they start to advocate for others. And so community is a big part of that healing. I oftentimes will have events where they get to meet other people going through similar struggles, or maybe it's not similar struggles. It's just all of us are going through challenges that we may not know about. And there is a lot of healing in feeling supported. There's a reason why we say it takes a village. There's a lot of healing in feeling supported by other people within our community.
Yeah. And before this podcast, you told me yourself when you were, with a 14-year-old kid who was afraid of needles, right? And then you were able to use integrative medicine and hypnotherapy to help him, get over this fear. So can you talk a little bit more about that?
Yeah. So I had a patient who was on a particular medicine that's kind of like an EpiPen. So it was an injection that he had to take for his eczema. And at some point, the anxiety and the fear of the needle became too much. And it's not really something that you want to fight a big 14-year-old on. And, he understood like what the medicine was doing for him, and he wanted to do it. He just couldn't get himself to do it. And I had learned, in our training for clinical hypnotherapy, I had learned some modalities or some techniques to help him overcome that fear. So I asked him if he was up for it, and he's like, yeah, let's do it. And so we kind of took him so just to kind of give you a little bit of background of hypnotherapy, I know a lot of people have this misconception that kind of what you see on stage hypnotherapy, that, with a pendulum, you're getting very sleepy, or you make people do fun, silly things on stage, like clucking like a chicken and all that kind of stuff, which are just tricks. But really what hypnotherapy is it helps take you to a safe place where your brain waves are slowed down. So like a meditative state where you can access the parts of your mind that carry all our memories, all our belief systems, some of which might be holding us back. And so for him, I took him to the place of where these core, this fear started, the memories that created this fear. And we were able to desensitize it once he was able to be an observer of what he had experienced. And then we were able to replace it with something that he would rather feel, which is, to feel safe, to feel calm, to feel in control, and all of that. And so once, I took him out of it, he kind of sat up really straight. His eyes were really wide. And he was like, am I ever going to feel this fear again? And I said, you're going to encounter it, but now you have the tools to be able to handle it better. And when he walked out of my office, he walked out a different person. A week later, mom sent me a message and said, hey, he was able to take the medication. He didn't flinch, but he also told me that everywhere he looked, the colors were brighter because the veil had been lifted. And that was the last time he took that medication.
Wow.
Because, what he previously thought was impossible is now possible. So again, he no longer felt defined or limited by any challenge. And so the reason that he needed to take that medication didn't exist anymore. And so he was able to conquer and overcome that too.
Really common saying in Eastern medicine is that when you treat someone, you treat the whole person, right? You don't just treat, one part of the body. So kind of what does this mean to you, and how do you put this into practice? Instead of, treating one spot, of a person, you treat the whole person, right? And you treat the person as a whole.
I think part of it also started with, so I kind of took a little bit of a circuitous route to get to pediatric dermatology. I actually trained in pediatrics first, then I did dermatology, then I did pediatric dermatology. And, a lot of people often ask me, well, do you regret doing a whole pediatric residency? And I say absolutely not, because that really taught me how to see the whole person, how to advocate for patients. So I don't ever just see their skin. And a lot of what we see on the surface of our skin, or what physically ails us, has deep emotional and mental roots to it. And so it's important for me to talk to them about how, for kids, a lot of times I'll tell them, in order to take care of what's on the outside, it's really important to take care of what's on the inside. How you think, how you feel, what you put in your belly, how you move your body. Because if you take care of what's on the inside, it's easier to take care of what's on the outside. And when I talk to them in that way, they really get it. So we talk about nutrition. We talk about stress reduction. We talk about what brings you joy, because all of it is relevant. And again, it goes back to helping them feel empowered with the tools that they need to heal themselves.
And going off of this, one topic that is really big online is topical steroid withdrawal. And coming from a both academic and also integrated background, how do you handle a family who comes to you, thinking that their child is going through topical steroid withdrawal?
Yeah. So, again, it's that sort of topical steroid withdrawal oftentimes will come at a point when they've been so dependent on that topical steroid for so long that it now has lost its effect, or even has the opposite effect. And it can be a very long, debilitating road to allow their body to not feel like it's dependent on something, to not feel like it's in survival mode anymore. And so a lot of what gets them to that place where their body can now recover is, again, it has to feel safe, physically safe, mentally safe, emotionally safe. And so we talk a lot about how can they take care of their body every day? How can they take care of their mind? How they can take care of their heart? I have had many patients that have gone through topical steroid withdrawal that I will collaborate with my traditional Chinese medicine colleagues because, again, it's about how do we restore that balance in their body. We talk a lot about nutrition. And so all of those are really important to get their body back into a state of balance physically, mentally, and emotionally, so that their body doesn't feel like it's in that survival mode, that fight or flight anymore.
Yeah, talking about traditional Chinese medicine, I want to ask you, have you ever tried acupuncture before?
I personally have not, but I have had many people in my life who have tried it, particularly for anxiety, who have also tried it for infertility, and it has worked wonders, because what's the idea behind acupuncture is to decrease that stress, that inflammation in our bodies, to bring it back to balance. And I think that's, you're talking about what does integrative medicine mean to you? I mean, a lot of it is how do we bring our bodies back into balance, because so much of the way we move in the world is in survival mode, because we're just doing all the time, and we forget that we're human beings, not human doings, right? And so a lot of Eastern medicine, if you kind of if you integrate that with what we know with Western medicine, it's really just teaching people how to be.
Last spring I had terrible allergies, and I took a lot of Claritin, I took like Desertec and all that, and it never seemed to work. So that's why I actually tried acupuncture for myself to see if and it worked wonders, as you said, with a lot of patients. It personally, it worked a lot for me. And what I found really interesting about acupuncture is that, for example, when I have allergies, I get runny nose, and like my nose, it like all swells up, with my face and all that. But when with the pressure points and stuff, they actually put it at your nose, but also your hands and feet and your calves. So it's actually all over your body. And when you study traditional Chinese medicine, it really I'll put this picture like on the video, but it's like I took a picture of this. It's like the person with like the meridian maps and all that stuff, with connects all your body, and super interesting. Which gets to the point where when you treat a person, you want to treat the whole person.
Well, I mean, we are constantly exchanging energy all the time, and a lot of that energy we carry within us. And so a lot of times when I do hypnotherapy or any number of these techniques, you can literally see a weight lifted off, that they actually feel lighter because they're not holding on to energy that no longer serves them. And so, I mean, I personally haven't done acupuncture, but I do use acupressure techniques, which are rooted in traditional Chinese medicine. One of the modalities that I oftentimes will teach my patients is emotional freedom technique, which is like another word for it is tapping, but it's basically using the concept of acupressure to decrease cortisol levels. It's almost like a somatic release, and to reframe what it is that you're experiencing. So a lot of times when our body is experiencing any particular ailment, for example, pain, I don't know where I heard this, but I have carried it with me, but pain, pay attention inwards now, meaning that our bodies are signaling to us to pay attention to something so that we don't ignore it, because otherwise it just gets worse and worse. And so when we acknowledge what it is that we're experiencing, whether it's pain, whether it's itch, whether it's fear, anxiety, or anger, whatever emotion that we're experiencing, and then we can reframe it in a way that serves us. So one of the ways that I do that is, so we call this kind of on the side of the hand. You can do it in different acupressure places in different parts of your body. But just to simplify it, you can do it on your hand. So let's say you're experiencing, you're afraid of something. So even though I feel afraid right now, I still choose to love and accept and heal and integrate that part of me. Or whatever phrase resonates with you.
Yeah.
You kind of check in before you do that with yourself, like on a scale of 1 to 10, where am I, how bad is it?
Yeah.
So that you acknowledge what it is that you're currently experiencing. And then, acknowledge it in your body, and then reframe it in a way that, okay, I understand that I have this, but I also know that it's fleeting, that it's temporary, and that I have the power to change it. So you reframe it in kind of a positive framework that you can do something about it. And then do that 7 times, and then actually physically release that energy from your body with long exhales. So let's say you exhale 7 times. A lot of times people will say, take a deep breath in, which is important, but also how you breathe out. If you breathe out for a prolonged period of time, that activates your parasympathetic nervous system, our rest, restore, heal, digest, versus that fight or flight survival mode. So when you physically use your breath and that kind of a somatic release with the tapping, that in combination releases that energy from your body. Then check back in on a scale of 1 to 10. Where am I feeling it now? Maybe you felt a 7 before, and now you feel a 5. So keep doing that until you get it down to like a 0 or 1. It's a really powerful technique to do. One, because you can take it with you wherever you go.
Yeah.
Your breath is your own superpower. You don't have to really tell anybody that you're doing it. You can do it very quietly. And again, there's no side effects to it. The worst thing that could happen is that it doesn't do anything. But I've very rarely seen that it doesn't do something to reframe that acute sensation of whatever it is that you're experiencing in that moment.
Yeah. You founded the Joyful Path, and you talk extensively about joy as a clinical therapeutic tool. And when a child is dealing with a painful medical routine, what does prescribing joy look like for them?
Yeah. So for a lot of people, I do like to kind of preface that with that joy isn't the absence of sadness. It's what allows us to experience all of what makes us human.
Yeah.
So I oftentimes will tell people it's kind of like a swing. At that moment where time stands still, you have to commit to powering through the depths of sometimes fear, grief, sadness, anxiety to reach new heights of joy. Because we'll all experience obstacles to joy in our life. It's part of the human experience. But if we pay attention to it, acknowledge it, learn and grow from it, then we can choose how we might intentionally respond as a result. And so, when I prescribe joy, is what I'm trying to get them to do is to really slow down, to pay attention inwards, to what it is that they're experiencing, so that they can kind of be a non-judgmental observer of it, extract the wisdom of why they're experiencing what they're experiencing, because we will all face hardships in our life. It's just, we can't numb ourselves to that. And then from that space, because it doesn't feel so heavy. And again, sometimes it's moment to moment, because when you're I think you can't have joy without having moments of grief. You don't understand what joy really means until you've experienced sometimes the kind of direct opposite of that, like the pain of loss. And so it's not to diminish either of those, because heights of joy is also fleeting. You're not always going to be in that state all the time. You're not always going to be in grief at the time, but they can coexist. And both of them are so very deeply important to the human experience. And so joy looks like a lot of different things. It looks like playing. It looks like being open and curious, learning new things, experiencing new opportunities, meeting new people, exploring new places. It can also look like when you're mindful, when you decide. So every month I take people on Shinrin-yoku forest bathing walks, different places around town, and the idea is not so much the exercise. I mean, obviously you're walking and you're doing exercise, but the idea is to slow it down, to really engage with the world around, engage in our senses, because what are we doing so much? We're just so distracted by like technology and, we're so much more digitally connected, but so much more emotionally disconnected. And so the idea is, how do we become more present to, what's going on all around us? How can we be more connected to ourselves and the world around us? So to me, the definition of joy is it's a state of being where we are deeply connected to ourselves and the world around us, that we can create and cultivate even in the face of overwhelming adversity. And so what that, and it's an intentional practice. It's not something that you're not going to be joyful all the time, but when it becomes an intentional practice, that you have moments where you're cultivating gratitude, you're cultivating curiosity, you're cultivating creativity, you're cultivating community, all of that, then it becomes your new baseline. So that when things knock you out off that baseline, it's easier to get back to it.
I want to get into some of your research that you've done. In your study on congenital melanocytic nevus, you looked at how pediatric dermatologists and plastic surgeons have different views when it comes to early surgery versus monitoring. So, when a patient comes to you with a newborn who has a large satellite nevus, they're usually very terrified. So, how do you help them navigate through this process? The surgical risk, the cancer monitoring, and just letting their kid grow up without feeling self-conscious?
Yeah, I mean, I think as a pediatric dermatologist, a lot of what I teach people is how to love the skin that they're in. Because, each and every one of us are born with different different skin colors, different skin types, different things on our skin, many of which, what I try to get people to a point is to feel not defined or limited by those things, to be more focused on who they are than what's on the surface of their skin. Because sometimes we can take it away, but many times it's something that they might have for the rest of their life. And so, when I talk about, and sometimes there is a surgical option, but in general, unless there's a really strong medical reason for them to remove something, I want them to feel comfortable in their own skin. So when even with parents at an early age, before their child is cognizant of what they haven't even really noticed what's on their skin, I try to help the families feel comfortable with that first, because they're going to pass that on to their child. Because if they're constantly, talking about it, if they're constantly paying attention to how it sticks out, or I mean, unfortunately, I've had some families come and said, okay, we need to get that off because it's ugly. And even though that's not what they said, what their child sometimes will hear is, my mom thinks I'm ugly. It's not what they said, but words actually really matter. And so how they draw attention to it, how they allow their child to be confident in who they are is shaped at a very early age. The language behind how you speak with it is going to make a huge difference. And for me, like when they're old enough and I can speak to them, I will often say, what's really cool is that there is not a single person in this entire world that has the same exact birthmark that you have. And I think that's really cool.
It's pretty amazing.
And I mean, I want them to know, one of the things that I like to say to my patients is that there is no one that ever was, is, or will be the uniquely beautiful being in front of me. And I want them to say that to themselves in the mirror, so much so that they start to believe it.
And, final question is, dermatology, they often focus on treating, what's on the surface, right? So, when a kid comes in with a skin issue, that isn't responding to standard treatments, what do you start looking, like with the underlying issue, right? The gut health, the diet, or the home stress, and et cetera. Yeah,
I mean, kind of going back to, I think a lot of what physically ails us oftentimes comes down to, core mental and emotional things that we're experiencing. There's so much of what, our skin is kind of like a window to what's going on underneath. And, a lot of times when things feel kind of out of control, or let's say you're feeling core emotions of fear and anger, sometimes that shows up as anger in the skin, inflammation in the skin. And so I do think you can't address one without the other. So I can teach them how to take care of what's on the surface of their skin, but if we don't really talk about what's kind of triggering it, then it's going to keep coming back. And so this comes back to treating the whole person, because ultimately, if they feel more in control of their emotional and kind of mental well-being, the physical part always seems to kind of follow. And so many times we get to a point where even though whatever it is that they're experiencing isn't fixed or cured, it doesn't mean that they can't heal from it. Because, for example, I mean, I am part of we might have talked about this in the last podcast, but I have been part of a camp for kids with chronic skin conditions for over 20 years. And at the beginning of the camp, these kids come in shy and sure of who they are. And by the end of it, because we've created a safe space for them, they stretch out of their comfort zone. They discover their individuality, their creativity, their own superpowers, what makes them them, and they're empowered with the knowledge that they're not alone. And by the end of it, they're completely different kids, and because they no longer feel defined or limited by their challenges. And so even though they might not be like fixed or cured, but they're healed.
Wow. Thank you so much for sharing, all your wisdom and experiences. Thank you for your time, and I'll see you guys next time.
You got it. Thank you so much.
Thank you.